turns out those popular weight loss drugs aren't getting to the people who need them the most. That, according to exclusive data obtained by NBC News. We're talking about drugs like Ozempic and Wegovy, and they're not covered, of course, by private insurance. And the out-of-pocket costs are more than $1,000 a month, financially out of reach for a lot of people who need that medicine. And there's a racial component to all of this as well. More than 4 million prescriptions were written for Wegovy and Ozempic last year in 2023. A vast majority of those prescriptions, 85%, were written for white people, just 12% written for African Americans who have significantly higher rates of diabetes and obesity. NBC's Berkeley Lovelace is joining us now. He's been looking at the data. All right, so two things here that I noticed as we're looking through this data here. Two things at play. Number one, the prohibitive cost, right? And number two, the drugs are being prescribed to people who may not need them the absolute most.
Right. So, yeah, there's a lot of things going on here. So one is insurance. And so, as you mentioned before, these drugs cost about $1,000 for a month's supply. And so insurance companies are often reluctant to pay that because it does cost so much. But there's also a stigma associated with obesity. There's still many in society and even in the health industry who see this as like a cosmetic concern or a willpower issue versus a chronic disease. So there's that. Then there's access. So there's also in some states a lack of doctors who are qualified to prescribe these medications. And there's also very much telehealth restrictions still at play even after the pandemic. And then on top of that, there's also costs. So there might be white families who may be able to afford to pay $1,000 out of pocket if their insurance doesn't cover it, versus maybe a black family who would not be able to pay that as well. So we actually have a doctor in Norman, Oklahoma, who kind of laid that out for us as well.
Go a little bit deeper into the racial disparity issue here and what the implications are.
Yeah, so when we looked at the map, we saw that many of the states, such as Oklahoma, Louisiana, and West Virginia, they had very high adult obesity rates, but also very low prescription rates. And so when you look at the data, it says nationwide, there's 85% of people who have these prescriptions are white people. But if you look at closer at these states, only 12% of black people have prescriptions.
And it's interesting because, as we mentioned, there are higher rates of diabetes, of course, and high blood pressure with African Americans. They're the people who presumably would need it the most for an acute medical condition, not just to lose weight for cosmetic reasons.
Right. And yeah, we spoke with patients as well. So we spoke to one patient in Oklahoma. She also has a history of heart disease. She's black. And she said she's basically just frustrated. You see, celebrities online.
Because she can't afford it?
Because she can't afford it. And also you see these celebrities online talking about these weight loss drugs. A lot of times doctors will do everything they can to make sure they can try to get these medications. A lot of times there's nothing really they can do to get their drugs. So a lot of times the conversation just goes to alternatives. The patients have tried Nutrisystem, Weight Watchers, everything you can think of, and they're still struggling to lose weight.
Berkeley, thank you. By the way, welcome to D.C.
Thanks.
Berkeley Lovelace with NBC News.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.